Hi everyone, welcome to Earthbound Health, where we care about your health and ours. Join me today as I dive into the dangers of one of the most groundbreaking weight loss drugs ever to hit the market. Taken by millions, this drug has risks that more and more people are becoming aware of. Ozempic was originally developed to manage diabetes, but has recently been repurposed and aggressively marketed as a weight loss solution. The change in what this drug was originally marketed for is being pushed by high-profile people, including celebrities and athletes. Oprah Winfrey is one of the most famous people to use a weight loss drug. Pharmaceutical companies are also pushing the drugs. When the FDA rapidly approved these drugs, millions of dollars were spent on marketing campaigns, which caused the drug to become even more popular. Unfortunately, this is very similar to the early stages of the opiate crisis, where at first there was a lot of enthusiasm and promise about the drugs. They were widely promoted, and this promotion overshadowed the concerns about long-term safety and potential abuse. Of course, we all know now the tragedy caused by the opiate epidemic. Before we talk about the dangers of Ozempic, I'd like to give you some little-known history and background of the drug. Most people don't know that Ozempic was strategically marketed to targeted demographics. The manufacturer of Ozempic targeted African Americans by funding civil rights organizations to promote the drug. Anyone who complained or criticized this targeting based on race was accused of racial discrimination. And no, I'm not making this up. This discouraged criticism and encouraged widespread acceptance, regardless of the drug's potential risks for this group. The FDA also approved Ozempic for children aged 12 and older who suffered from obesity, even though there are ongoing debates and concerns about the drug's long-term effects on younger populations. The American Academy of Pediatrics has published guidelines recommending weight loss drugs for childhood obesity, leading to more and more prescriptions being written. Critics say that this endorsement has to do with profits rather than solid long-term safety. The elderly were also targeted in Ozempic marketing campaigns. But for these older people, the high cost of Ozempic was a barrier. It was priced between $1,000 and $1,500 per month, which they can't afford without insurance. But an obesity rights coalition funded by Ozempic's manufacturer is trying to get Medicare to cover these drugs. But this could lead to higher costs, which will have financial implications for the healthcare system. These economic interests, which are driving the promotion of Ozempic, are overshadowing patient safety and informed consent. Let's talk about the risks and side effects of Ozempic. The use of Ozempic at high doses, which is intended for weight loss, can cause severe gastrointestinal problems. The drug slows gastric emptying, and this can cause nausea, vomiting, and abdominal pain. A study involving over 25,000 patients found an increase in intestinal obstruction rates among users of weight loss drugs. Ozempic users have a much greater risk of developing severe inflammation of the pancreas. The risk of bowel obstruction is also much higher in Ozempic users compared to other weight loss medications. Imagine when you eat, the digestion of the food and the stomach's emptying process is slowed and delayed so much that you develop a chronic issue. This is called gastroparesis, a serious condition that affects the entire intestinal system. People who take Ozempic have a much greater chance of developing what is called biliary disease, which involves the development of gallstones. Vision loss and potential thyroid cancer are also conditions reported by users. People who take Ozempic risk not getting enough nutrition because the drug may alter the structure of the small intestine. This was found to be the case in animal studies, where intestinal obstruction prevented the nutrients from being efficiently absorbed. The phrase Ozempic face is going viral. What is Ozempic face? It describes the facial changes that some users experience because of the rapid weight loss associated with the drug Ozempic. People with Ozempic face have a gaunt appearance, sunken cheeks, and pronounced facial lines. These changes occur because the drug causes so much fat loss, including in the facial area, leading to a hollowed and aged look. The primary cause of Ozempic face is the rapid reduction in body fat caused by high doses of the medication. Users who experience a lot of weight loss often quickly see their facial fat diminish, resulting in a sunken appearance. Also, the drug's effect on slowing gastric emptying can cause calorie deficits, making the loss of fat worse and contributing to the formation of the Ozempic face. The cosmetic changes associated with Ozempic face can affect users' self-esteem and social interactions. The distress caused by these changes suggests that those considering using Ozempic should carefully research the drug's benefits versus its side effects. Ozempic also has a serious effect on psychiatric health. Ozempic's effect on mental health is a growing concern. People who take psychiatric medication should be very careful if they are considering taking Ozempic. Because the drug slows gastric emptying, it can affect the rate of absorption of psychiatric medications. This can cause people who are on the medications to become destabilized and their condition made very much worse. Reports indicate that Ozempic increases the risk of suicidal thoughts. The interaction and connection between the gut and the brain is well known, and Ozempic negatively affects this intricate process. So, it's important to monitor your mental health if you're using Ozempic, especially those with pre-existing psychiatric conditions. The story of Ozempic reflects broader issues in healthcare, where economic interests often outweigh scientific evidence in shaping medical guidelines. The drug's aggressive promotion, coupled with its significant risk and high costs, highlights the need for more rigorous evaluation of medications. As the healthcare landscape evolves, addressing both obesity and systemic issues in drug marketing, it's important that patient safety and effective treatment be considered. This is why it's crucial to critically assess the risks of Ozempic and make informed decisions about its use. Thanks for watching. Be sure to subscribe and check out other related videos on my channel, where I dive into the world of natural health cures. Until next time, be well, be safe, and be prosperous.